Welcome to this video tutorial on how to access venous access ports or VAPs. This tutorial is intended for adult patients in the inpatient setting at Kaiser Permanente Roseville. For further details, please refer to your facility's policies and procedures. There are several steps you need to take prior to accessing a VAP. First, you need an order to access. If there is no order, obtain and verify orders to access the VAP. Next, determine if the VAP is a power port or non-power port. Sometimes the patient will know what type of port they have. However, if there is any doubt, you can check the placement documentation on the LDA doc flowsheet. This step is necessary as it will help determine what type of Huber needle you will need, a power or non-power port needle. Next, determine the size and length of the Huber needle needed. In general, a 3/4 inch or 1 inch needle is the most common length needles used for patients of ideal weight. Lastly, do you need a local anesthetic? Patients who frequent the clinic may ask for a topical anesthetic spray. However, this is not available in the hospital. An alternative is obtaining an order for EMLA cream. This can be applied to the incision site area and covered with Tegaderm for approximately 30 minutes prior to accessing the VAP. Now it's time to gather all your supplies. You will need a central line dressing kit, Huber needle with attached extension set tubing. Again, make sure you know what type of port the patient has, a power port or non-power port. In our facility, there are various different types of Huber needles. Pictured here are just some of the ones our facility carries. The packaging should state if the Huber needle is for a power port or not. The packaging generally says power lock, as in the picture in the middle. Make sure to double check as power port and non-power port Huber needles are not interchangeable. SorbaView Shield dressing, 2 access devices or injection caps, and 2 sterile 10 cc normal saline flushes. It is important to know that these are different than the standard pre-filled normal saline flushes found on your units in the medication rooms. If sterile normal saline flushes are not available, additional supplies are needed, including 2 alcohol pads, 2 4x4 gauze pads, 2 10 cc syringes, and 2 normal saline vials. First, determine your work field. Will you use the patient's bedside drawer, the patient's table, or another work surface? Once you've determined your workspace, clear it of all items. Lastly, make sure to sanitize your workspace with SaniWipes. Now that you have prepared your workspace, it's time to locate the insertion site. First, perform hand hygiene and put on clean gloves. If EMLA cream was used, this is the time to clean it off. Now, position your patient's head turned away from the implanted port. If the patient has a cough or is unable to position their head away, place a mask on them. Now palpate and locate the septum. Some patients will have 3 markers or bumps in the shape of a triangle, while others do not have these markers. Now, continue to palpate and determine the edges. The Huber needle should be inserted in the middle of your markers. Now it's time to prepare your supplies. Don't forget that accessing a VAP is a sterile procedure. Again, accessing a VAP is a sterile procedure. Open your sterile central line dressing change kit and place it on your prepared and clean workspace. Maintaining sterility, place all your supplies on the sterile field, including the 2 sterile saline flushes, 2 access devices, the SorbaView shield dressing, and Huber needle. If sterile saline flushes are not available, the following additional steps are needed. Remove caps from both normal saline vials and scrub tops with alcohol pads. Set vials aside near, but not on your sterile field. Maintaining sterility, place additional supplies on your sterile field, including the 2 4x4 gauze pads and 2 10cc syringes. Now remove your gloves and perform hand hygiene using the antiseptic gel found in your dressing kit. Put on your sterile gloves and place the sterile drape below the VAP insertion site. Now it's time to prepare your Huber needle. First, connect the sterile normal saline flushes to the access devices. Then, attach the access device to the Huber needle extension set. Lastly, prime the tubing and place the setup back onto your sterile field. If sterile saline flushes are not available, you will need to prepare your own sterile 10 cc normal saline flushes. Maintaining sterility and using aseptic technique, take your 10 cc syringes and puncture the normal saline vials without touching them. Now invert your syringe and vials and using the sterile 4x4 gauze pads, hold the normal saline vials and fill your syringe. Continue to maintain sterility and discard the 4x4 gauze pads and saline vials. Now continue to prepare your Huber needle as if you had pre-packaged sterile normal saline flushes. Attach your syringes to the access devices. Attach the access devices to the Huber needle extension set. Prime the tubing and set it aside on your sterile field. Now it's time to clean your insertion site area using the provided chlorhexidine swab sticks. Per the manufacturer, tear open the packaging at the notches. Twist and remove one swab stick at a time from the handle. Make sure not to touch the foam. Using the flat side, cleanse the insertion site area and the area to be covered with the dressing using vigorous back and forth strokes, both up and down and side to side. Use all 3 swab sticks sequentially to clean the coverage area. Total application time for all 3 swab sticks should be at least 30 seconds. Let the site air dry for approximately 1 minute. Now that you've cleansed your insertion site and let it air dry for at least a minute, it's time to insert your Huber needle. With your non-dominant hand, stabilize the implanted port. Grasp the Huber needle with your dominant hand and insert the needle into the center of the port septum, going through the skin perpendicularly or at a 90-degree angle. Apply steady pressure until the needle touches the base of the port reservoir. Now, aspirate and check for blood return. Now that you've established blood return, place the chlorhexidine impregnated biopatch under the needle with blue side facing up. Make sure to recheck for blood return again after placing the biopatch. Any slight displacement of the needle while applying the biopatch can affect blood return. If blood return is not received after applying the biopatch, readjust your needle until you get blood return. Now apply the skin barrier wipe and let it dry completely. Once dry, secure the needle with the Steri-Strip and apply the SorbaView Shield dressing. Next, date, time, and initial your dressing. And if you access the power port, make sure to place the device verification sticker on the infusion set, indicating that the port is a power port. Lastly, document your procedure on the LDA doc flow sheet. So you've accessed the VAP and it's flushing well, but you don't get any blood return. What should you do? Palpate around the septum area to make sure that the saline flush is not accumulating in the surrounding tissue. If there is no accumulation of fluid, it may mean you have accessed correctly, but there is a fibrin sheath preventing blood return. If this occurs, place your biopatch and apply the dressing as you normally would. Then obtain an order for cathflow and instill per the package insert instructions. If you are able to get blood return after cathflow dwell, you are now ready to use your VAP. If there is still no blood return, remove your needle and re-access the VAP again. In order to prevent central line associated bloodstream infections and to keep your VAP functioning properly, there are several maintenance and care tips that need to be followed. When you start to use a newly accessed VAP, make sure to discard of any old IV fluids and IV tubing in the patient's room, and use all new IV fluids and IV tubing setups. Cover your IV tubing ports and VAP ports that are not in use with the green Kuros caps. Make sure to change the VAP dressing and the Huber needle every 7 days. If the VAP dressing starts to come off, do not reinforce the dressing. Change it. In order to prevent the VAP from clotting off, it is important to flush the VAP properly. VAPs should be flushed with 20 cc's of normal saline followed by 5 mL of heparin, 100 units per ml, using a push-pause technique. If heparin is contraindicated for your patient, flush with at least 20 cc's of normal saline, again using the push-pause technique. So when should you flush your ports with heparin? They should be flushed after blood sampling, when converted from continuous to intermittent use, when not in continuous use after administering fluids or medications, or at least once daily. Now that you've learned the steps on how to access VAPs, maintenance and care tips, and when to flush, let's watch one last time from the beginning to end. This concludes our tutorial on how to access venous access ports. Thank you for watching and good luck on accessing your next VAP.